Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of biochemistry with the topic lipid metabolism, and the subtopic will be cholesterol synthesis. So let's start.
Welcome to the medical examination on lipid metabolism. We'll focus on cholesterol synthesis. To begin, can you tell me which specific molecule acts as the primary precursor for the entire cholesterol biosynthetic pathway? This information is for assessment purposes only and is not medical advice or a diagnosis. Please see a healthcare professional for advice or to seek care.
Two acetyl-CoA form acetoacetyl-CoA with another acetyl-CoA. This gives HMG-CoA by HMG-CoA synthase, and this is the basis or the primary precursor for the entire cholesterol biosynthetic pathway.
Excellent. That's a thorough explanation of those initial steps. Now, could you pinpoint the rate-limiting enzyme in this pathway and how its activity is regulated, particularly when cholesterol levels in the cell are high?
Yes, the rate limiting step is the conversion of HMG-CoA to mevalonate, often referred to
right.
as.
And which enzyme catalyzes that specific reaction?
The
also,
enzyme.
can you elaborate on how it's regulated?
The enzyme involved is HMG-CoA reductase pathway, and the regulation is happens when intracellular cholesterol levels are high. HMG-CoA reductase activity decreases. When levels are low, its activity increases.
Exactly. That's the principle of feedback inhibition. Now, considering its crucial role, do you recall any clinical applications or medications that target this enzyme directly to manage conditions like high cholesterol?
Yes, statins are prescribed to manage high cholesterol, which act as competitive inhibitors.
Precisely. Statins are key drugs in managing dyslipidemia. Since we've discussed the synthesis, can you now describe the main lipoprotein responsible for transporting newly synthesized cholesterol from the liver to other tissues?
Yes, it's lipoprotein A.
Actually, lipoprotein A is a specific type associated with increased risk, but the primary transporter for endogenous cholesterol from the liver is very low density lipoprotein or VLDL. Now, once this VLDL delivers some of its lipid cargo, what does it eventually transform into?
It transforms into LDL.
Exactly. That's in what is the primary role of that LDL particle in the body?
It carries cholesterol to the cells, but in excess, it builds up as plaque in artery walls.
That's precisely why it's considered the bad cholesterol. To conclude, can you briefly outline the role of HDL in cholesterol transport, focusing on its function that counteracts LDL's action?
Yes, LDL helps remove cholesterol from arteries, transporting it to the liver for excretion, which reduces cardiovascular risk.
You've correctly explained the role of good cholesterol. But just to clarify, that molecule is HDL, not LDL. HDL is responsible for that reverse cholesterol transport. That concludes our examination. Thank you.